Hello everyone. I want to thank you for attending this important event on the role of surgical care as part of the Universal Health Coverage 2017 Forum. Achieving universal health coverage is one of our key missions at the World Bank Group. We're committed to ending extreme poverty by 2030 and boosting shared prosperity for the poorest 40% by accelerating inclusive, sustainable economic growth, by building resilience to shocks and threats, and by investing more and more effectively in people. We can't get there without universal health coverage. Surgical conditions represent nearly a third of the global burden of disease, so surgical care is critical to achieving UHC. Surgical care is also a crucial component of building strong health systems, but one that's often overlooked. It's essential to treat and manage a broad range of conditions and disease categories, including maternal and child health, trauma, non-communicable conditions, and infectious diseases. Surgical care at the district level has been shown to contribute to a 10-fold increase in economic activity, as well as improving the health and well-being of families and entire communities. And most importantly, every 2 seconds, a person dies because of a condition that could be treated or managed with surgical care. But right now, 5 billion people cannot access safe surgical and anesthesia care when it's desperately needed. The poorest third receive only 6% of all surgical procedures. And as many as 81 million people are impoverished each year while seeking the surgical care they need. There are many barriers, such as health workforce training and availability, the distance to care, lack of essential medicines, and out-of-pocket costs. We must commit to overcoming every one of these barriers. The cost of increasing surgical capacity by 2030 is not negligible, an estimated $350 billion. But compare that to the $12.3 trillion in lost GDP in low and middle-income countries if we don't invest in essential surgery and anesthesia. The World Bank Group will continue to help in bringing private sector solutions and funding mechanisms that integrate surgery, anesthesia, and obstetric care as part of health system strengthening initiatives and the effort to achieve universal health coverage. Our global financing facility is a good example of an innovative funding mechanism that's integrating timely access to quality surgical care through the provision of emergency obstetric care and cesarean sections. We need all of your ideas to help close this gap and ensure that essential surgical care is available for those who need it most, at every income level, in every country, everywhere in the world. Thank you for being part of this important discussion. I look forward to hearing the results.